one physician put up their hand and asked about there's any danger of the children that could possibly pick up a harm reduction kit and ingest the narcotic that's inside the bag. If a physician thinks that, how many people in our community think that that these kits that everybody's fighting against may actually have drugs in them?
I gave a talk last week to a bunch of high schools as part of the Toronto School of Public Health, and it was an hour and a half, and I was supposed to talk about basics of addiction, pain, and those things. And in the afternoon, a scholar was going to talk to them about safer supply, and it sort of threw me off base a little bit, like, 'cause I thought, like, oh, do I talk about that? Do I not? What do I share? All that stuff. And so I was talking about, like, treatments for addiction and methadone, Cadian, all that jazz, and I didn't frame it, right? So when you educate people about stuff, it's helpful if you pause and say, hey, what are the two things of this? Then they answer, then you give them the answer. I didn't pause, so I didn't like segment the talk. It was almost like I was imagining our talk today being where we just talk about random stuff and everything gets jumbled together. And and then a few of the kids were like, well, not even kids, they're like, whatever, 15, 20, I don't know. They were like, aren't there regulatory things in the pharmacies? Because they thought when I was talking about the unregulated drug supply, they thought I was talking about prescription grades from the pharmacist.
Yeah, I think it's. I think you bring up a really good point about when we do various talks, and it's sort of like there's got to be this base understanding of. And I think back to my talk about harm reduction kits, and I won't say what health organization I was giving this talk at because it might be embarrassing to that health organization. But as odd as this will sound, one physician put up their hand and asked about, do you think there's any danger of the children that could possibly pick up a harm reduction kit and ingest the narcotic that's inside the bag?
The vitamin C capsule, or the saline. Yeah, no.
They thought.
Yeah, they thought you're actually giving out drugs. Yeah,
they thought this is a medical doctor, and I'm not trying to call out medical doctors, but you just thought that there were opiates inside the. By the way, for a basal understanding, we don't have a kit here with me, but a harm reduction kit has got a few clean needles in it, some alcoholic swabs, a tourniquet, and a few other items in it. None of them are ingestible to the point where you could get. There's no drugs in it. But you got to kind of get that base understanding of what the harm reduction kit is. So I think it's, I don't feel bad for the high school students.
Well, I feel bad for me for not realizing what their base understanding was and setting the frame.
Maybe I feel bad for your students in your class that left without the understanding.
Well, no, because it's a full week they're doing.
Okay.
And so I talked to the preceptors afterwards, and they're like, don't worry, we'll correct it. We'll make it clear, right? And so forth.
But you got to lay out that understanding and I think if you think about it, and I really had it was a good opportunity for me to check myself when I do these talks in various places, because it's like, and not meaning to call out this very well-meaning physician who brought up the point, but if a physician thinks that, how many people in our community think that that these kits that everybody's fighting against may actually have drugs in them?
Yeah.
I would be against them having drugs in them.
Yeah,
right?
Yeah.
I mean,
the implications are just so much, right? Like the fact that there's drugs that we're handing out, there's no monitoring, no regulation. And then on the other side, we're like taking Tylenols off the shelves, right? Like because of fear of...
Yeah, so it's like maybe we're not arguing about the same thing, right?
Well, that's exactly what's happening, right? Like every time they talk about harm reduction saves lives or safer supply or whatever, everyone's arguing about slightly different things. They're not even there.
Can you imagine if all these people thought that both of us are advocating to hand out free drugs to children, right?
Yeah.
So if a doctor thought that, how many people think that we're trying to do that? I mean, that's just... Oh my goodness. Doesn't that kind of blow your mind a little bit when we think about the obstacles that we face in our programs? If some of it is just based on ignorance or our own inability to explain what we're talking about.
How do we create that baseline understanding so you can talk about nuance? I have no idea how that would, because harm reduction means so many, and it means different things every few years.
Yes.
Right? Like in terms of what?
It does, and it means different things in different cities.
That's true.
That's true. And harm reduction in Saskatoon is not harm reduction in Vancouver and Toronto. And so I think we have to maybe not assume that people know everything, and I think we need to give kind of that quick overview of what we're talking about. It may people that are kind of advanced learners, if you will, may be bored by it, but maybe it's best to make sure we're all on the same page.
Well, I think the few videos that a lot of people watched, none of them were experts, right? Like the audience was not experts that were watching. It was more of a general public audience, and you could see by the comments and the questions that were made. And so I guess we have to eventually figure out what we are. Like, are we that expert voice, or are we that voice where what you said is so helpful for me. Because if I were to actually frame what I was talking about first, what I was saying would make sense.
Yeah, right.
Like with every different subheading. Different subheading.
And it would just be
it would be in context.
So it's a good takeaway for both of us to sort of like maybe explain do the 30-second kind of a hover view of the topic as to what things are. Sometimes when we do our videos, I like to include a little like if we use a word that may to be common.
No, I noticed.
Kind of add a little graphic there.
Those graphic.
And so
it's probably like an hour each time. You put the
takes some time. But I'm getting faster at it. But,
oh my goodness!
But hopefully that helps people. And it's not helping people on the audio version of our product. But anyway, it's I guess it's the same as teaching anything.
So maybe we should frame this topic that we're going to discuss now.
Sure. Let's frame this. So we thought it might be interesting to just.
Thanks for watching. If you like what you saw, please feel free to like and subscribe. That way you'll get notified when we come out with new content. We try to come out with new content about every week or so. So anyway, thanks again and see you soon.